Advancement Committee. This is our very first meeting, and it should be a very positive meeting in getting some good information from staff, but also an opportunity to introduce ourselves to each other, since we have at least one new board member and one not so old board member. So we want to get to know each other a little bit better and share some thoughts. And we'll get into that in just a moment. Our committee consists of Dr. Martin, Mr. Humphrey, Dr. Scott, and Dr. Fisher. And I just told Mr. Humphrey,
no, it's Harvey.
I'm sorry, Harvey, that, forgive me, that Mr. Harvey and I have to go get our PhDs so we can be doctors also on this committee. So thank you for that. Before we proceed with the normal routine here, we want, I think, Dr. Scott, would you read the mission statement for us?
Sure. Nashville General Hospital mission statement: to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Fantastic, thank you. So that was your introduction to this board and this committee. Well done.
Thank you.
And Mr. Harvey, you did such a great job in the earlier meeting. Would you read the NGH vision?
Sure. Vision, leader in exceptional healthcare for all.
Well done. Thank you. Thank you. All right. This is, as I said a moment ago, this is a new committee. And we appreciate our board chair putting this together. We have lots of opportunity to discuss everything from marketing, public engagement, our foundation, and even in a broad sense, what the future of this building and a potential new building might be all about. And we'll get into all of that a little bit later. But today, this is about introductions and about hearing what our staff has been working on as it relates to marketing and public relations. And before proceeding, do we have anybody signed up for a public comment?
No, sir, there are none.
Okay, thank you. So with that, I'm going to ask Dr. Elders, who is our interim CEO, if she has any comments that she'd like to bring.
Good afternoon, board chair and board members. We are excited about this advancement committee and just looking forward to the work that you all will do to advance Nashville General Hospital and the healthcare for our community. That's my only comment. It's a new committee and we are just excited about all the things to come. So we appreciate your service.
Thank you, Dr. Elders. And we appreciate that comment because it is a new committee in a new era here at Nashville General Hospital, and it's an exciting time for all of us. There's a great level of excitement that I sense among staff. I think the staff is so passionate about serving this community, and we want to do all we can to help and support the staff, support the leadership in the goal of serving this community in the best possible way. And with that, I'm going to ask Kathy Poole to come on up and give us a summary of some of the marketing and PR information that the staff is working on. And then when you're done, if you'll transfer over to Kate from the foundation, so then we can have a full discussion in the aftermath.
Yes, so thank you. Again, my name is Kathy Poole. I'm the Public Information Officer and the Senior Director of Marketing and Patient Experience here at Nashville General Hospital. Before you, I put together a packet. We're also going to include research and clinical trials within kind of an overview, just because I know we do have two new board members, have had the pleasure of touring Reverend Scott throughout the facility and meeting with him. I know, Mr. Harvey, we will be doing that in the next couple of weeks. And then, of course, with Dr. Martin and you, Mr. Lesser, already being on the board for a while. But just within the document, You've already read the mission and the vision of the hospital, but just a little bit of who we are, where we stand today, our community roles, strategic priorities, and how we want to work together to strengthen our impact with both the Advancement Committee and the Nashville General Hospital Foundation Board. The goal is simple: to ensure that every effort, whether marketing, philanthropy, or even research, aligns toward one purpose, and that is improving the health and wellness of Nashville, just as our mission states. Nashville General Hospital is the city's oldest hospital. It was founded in 1890, making us the city's only safety net hospital. Well, I caveat that a little bit now that trauma's over at Vanderbilt. I'll give them credit for the trauma side of things with safety net. But we've had over 134 years of service, and we've become more than a hospital. We're a trusted partner within this city in health equity, medical training, and compassionate community care. Our values, in addition to our mission and vision, are to be compassionate, honest, have accountability, respect, and teamwork as the foundation of how we treat patients, the community, and one another. And in the community, we serve about 60,000 patients a year. We are the primary teaching hospital for Meharry Medical College, and we're deeply connected to our community through partnerships with churches, nonprofits, neighborhood groups, where we focus on prevention and chronic disease management. Our strategy is actually built around the quadruple aim: improving population of health, enhancing patient experience, reducing costs, and caring for the caregivers. We deliver this through comprehensive services. There's a list that goes into detail of what our core services are: inpatient maternity care, surgical. We're a trauma 3 level center in our emergency department, diagnostic imaging, cancer treatment, as well as specialty and primary care medical practices. This framework helps us stay focused on quality outcomes and patient-centered efficiencies. We serve the community through 3 campuses: the main location here on the Meharry Medical College campus, Metro Center, and then Bordeaux, which is our newest location that includes both a medical practice as well as a freestanding diagnostic imaging center. We've also added a freestanding pharmacy at the Metro Center location, and they also offer rehab therapy services at that location as well. Some of the key accomplishments this last year has been the Hope Meds program. I know Bowman's here. He can talk through that if needed. The opening of the imaging center, as well as the pharmacy, the new Cerner electronic medical record, and then our earning national recognition with both our Joint Commission accreditation as well as a Leapfrog safety score, fall of 2024 and spring of 2025 as an A. With the Advancement Committee, we want to build trust in the community, guide us in fundraising, donor engagement strategies, as well as marketing, branding, and advocacy. We also want to work together to deepen partnerships with civic and government leaders while identifying new board members, whether it be hospital authority or the foundation, and ultimately bridge the connecting hospital leadership, the foundation, and the broader Nashville community. The Marketing and Public Experience Division is represented here. There's an overview of the positions that we have. We've got a manager of patient experience that just started and has launched a customer service campaign called the Heart of Patient Care. I have the practice liaison, Ms. Simone Johnson-Jones. She is responsible for being out in the community, working to get referrals back into this organization and connecting with external as well as internal departments clinically. Then we have Chanel Lake Doxey back there. She is kind of a one-stop shop for communications as well as external liaison, working with Metro. She did come from the mayor's office previously, has a lot of experience within the Metro departments, and works on sponsorships and connecting us with other community organizations. Our marketing and brand strategist is next term is Kaylin Harris. She is celebrating 5 years here at NGH. And in the back, you will see a brand architecture page on page 16. It's one of the things we are working on how Nashville, the Hospital Authority, Nashville General, and then all the sub-brands that we have underneath. And then we also have the one that kind of keeps the glue together, Miss Terry Henschel. She's kind of keeps us all together. So we appreciate our team who is responsible for making sure that we do get our stories out there, that we are working internally and externally on Nashville General Hospital, the Nashville Healthcare Center, and the Nashville Diagnostic Imaging Center, and the Nashville Healthcare Pharmacy. So we always have a lot going on. Next, I'd like to bring up Dr. Alicia Fair. She is Senior Director of Population Health Clinical Research, and anything else? It'll be a surprise. Dr. Fair.
You can tell we get along well because I saw a twinkle in her eye and I wasn't quite sure what she was going to say next. So it is my pleasure to present to you board Alicia Malin Fair, and then I'm joined by my colleague Susan Owenby, who is the director of the Nashville General Hospital Office of Research, who brings to us nearly 40 years of experience in the clinical trials domain. I'm going to speak from page 10 in your booklet, but really before I get to the written word, I think it's important to note that everything we've accomplished since 2023, when the office was reopened, is strongly built on relationships, bidirectional communication, and the fact that our team members, 2 other nurses that aren't with us today, have worked at various organizations, what I like to call the research rectangle, because we're in 5 miles of academic research centers. So we could not, and as you'll see in my presentation, do this work in silos without a team science and interdisciplinary approach. So we are going to talk about the end of the mission statement, which is to translate clinical findings into practice. And what do I mean by that? Briefly, I was really excited for a PowerPoint because teachers are going to teach. But when we talk about the research studies in our portfolio, we want to distinguish those pharmaceutical research studies and those that are observational. Susie has the pharmaceutical clinical trials knowledge. What do I mean by that? Studies that are testing, they have the approvals, ethical approvals to test a drug, a device, a therapeutic modality for safety, for efficacy, for the maximum tolerated dose. And the patients, so that we work with our patients at Nashville General, and this is an ongoing and recursive conversation with our patients, we need to gain trust and make sure that health literacy is met by our patients, that they are then randomized into a group, whether it be the treatment group or the placebo. Why? Because we want to clearly look at the cause and effect of those therapeutic agents on our patients. So an example might be to look at whether or not a cholesterol-lowering drug reduces heart attacks. At this stage, most of our studies are phase 2 and phase 3. So we're looking at comparators on the market and the new therapeutic drugs that will be tested, as well as device. The advancement part of this, what's the budget part of this? When we have the trust of our pharmaceutical companies that come to us, and they openly come to Susie, we negotiate, she negotiates a very robust budget, because we can't do these studies without our frontline units, without radiology, without the lab. There's a lot of different blood collections, tissue collections, images, collection of survey data, and so forth. So Susie negotiates for a non-refundable startup fee, which means if the study's open, which we have 5 studies open now, and a patient isn't even enrolled on the study, there may be eligible patients, but because of the informed consent process, they can say, I'm not interested, and we accept that, of course. But we receive funds which then are placed in our research budget to allow our research team to continue to earn the continuing medical education and CEU credits they would need to stay, well versed. And because I think of the nurturing environment we have in our research team, both of our research nurses are pursuing masters. One Master's of Science in Clinical Information or Investigation, and another one an MSN at TSU down the street. So we have 5 studies. We have, most of them are in oncology. 5 studies are open in oncology under the stewardship of Dr. Robin Jacob. We have 1 gastrointestinal study under Dr. Benedict Meliaco, Dr. Benedict Meliaco, Dr. Ben. We have 2 studies pending. What does that mean? We've been site selected, and then the drug company comes here, tours our facilities, meets our well-qualified staff, and then they give a site initiation visit, and that is the point where the budgetary component comes in. Now, our observational studies, and this is important to pause here. We are working towards having observational studies with a principal investigator, scientist led at Nashville General Hospital. However, and you will see our peer-reviewed work on pages 17, 18, and 19, we work with Vanderbilt University Medical Center, Meharry Medical College, Tennessee State University. We've even worked with nursing students, I think, at Lipscomb and other organizations, because those type of studies are not a randomized study. You might be looking at a research phenomenon, idea, or a behavioral modality, but these are sometimes long-term studies where we observe patients where they are and then collect data either on their past history or their future, and to see what type of exposures lead to diseases. So we look at associations, not causes. And so an example would be comparing heart disease rates among people who already take different types of cholesterol drugs. So we already know our population of interest. To get a funded project is incredibly competitive. These days, scientists are just pleased if their grants are even reviewed with facilitative comments to reapply. So because of this, we apply for the grant money. It's kind of ordered in line items of certain categories of travel, salaries, supplies, and so forth. But if you don't spend the funds, they can be returned. So we really need to have fidelity to the grants. And we are, again, very grateful that the majority of our principal investigators are residing at Meharry, Vanderbilt, and Tennessee State University. I didn't specifically put the titles of the projects because this is being recorded. And what if a patient who's eligible for one of these studies learns more about the specific aims of the project that might bias their responses to participating in the study? But you can see that we have several studies open. We are going to be submitting with Tennessee State University and their faculty in nutrition sciences for a USDA grant on Monday. So I think this kind of can be summarized that the more we're on the community, the more we work with our colleagues across foundation, marketing, all of the clinical faculty and staff, and most importantly, our Congregational Health Education Network. There is a poster that was just recently presented last month with Dr. Rebecca Seelove, who's faculty at TSU, and our executive director of Chen is featured as an author on the poster. So we do, when we have peer-reviewed publications and presentations, we always emphasize the interinstitutional collaborations, very important. Because with that, it attracts more funding. We can generate pilot data to actually have more expanded research projects that have many sites and therefore a larger budget. And also not shown on here, when we look at especially our investigators at Vanderbilt University, many of them are in their fellowships. So they are increasing their research gravitas, and we are in partnership with them to do that. So I think that's very meaningful, that we work with either the seasoned full professor all the way from a postdoctoral fellow in our research program, and that's really how we're going to have a legacy program here at Nashville General Hospital. Those are all the comments I have.
Great. Thank you, Dr. Fair.
Thank you.
Kathy, you want to continue?
The philanthropic arm of Nashville General Hospital is the Nashville General Hospital Foundation. Their mission is simple but powerful: to evaluate, inspire, and nurture relationships that foster a healthier Nashville. The foundation fills gaps that traditional funding can't, supporting our patient needs, education, and innovative care programs. To talk more about the Nashville General Hospital Foundation, I want to bring up Kate Haygood, who is the acting manager for the foundation. Kate?
Good afternoon, committee members and board members, and thank you, Kathy. My name is Kate Haygood, and I am the acting manager for the Nashville General Hospital Foundation. I have actually been here, just celebrated my 9th year in September. I am very, very fond of this foundation, and I really enjoy the work that we do. The foundation, as an acting manager, some of the key things that I do are basically daily operations, campaigns. I run the volunteer program, and then making sure that everything that we do is aligned with the hospital. Our development operations coordinator, Olympia Williams, is amazing, and she manages all the donor records, does all the data entry. She handles grant management, event logistics, and actually keeps everything running and making sure that all of that information is going into our database, and then also making sure that everything that goes into our database that we actually get from donors also goes into our QuickBooks, which is in our accounting department. Of course, the key priorities for the foundation is we work on 3 priorities: health equity, access to health, and addressing social determinants of health, which is in line with the hospital. Our signature programs are women's health, behavioral health. We have a medication fund for the patients. We also have the Dispensary of Hope. And one of our cornerstone programs is the Nashville General Hospital Food Pharmacy. This food pharmacy is one of the only ones in this city and in Middle Tennessee. It has been, it has had many, many accolades all over the country. We actually are one of the places that Second Harvest comes to show other agencies how to set up a food pharmacy. The food pharmacy actually supports patients for their food insecurity. And what they end up getting is nutrient-dense food, fruits and vegetables, and actually shelf-stable food as well. Everything is on a heart-healthy diet. It's low sodium, low sugar. And these patients are actually tracked and watched for their different, say, their A1Cs or their blood pressure. So we are actually seeing changes in teaching them how to eat better and how to shop better. So the foundation was founded in 1977. It was a very small foundation, basically handling baby blankets for the babies, for the smallest of our patients, and then also patient care items. It also has been a place for grant money, so say Komen. We had a lot of Komen money, and that used to help us do mammograms, and so that money would come in, and that's where the money would end up, would be with the foundation. In 2016, the name changed to actually make sure that we sound and look like Nashville General Hospital. So we are actually mirroring that, and that is how Nashville General Hospital Foundation came to be. So as that, we've expanded the scope and our mission for that. We were a little bitty nonprofit, and now we are actually a larger nonprofit. And in 2025, we have added 2 key leaders, foundation board members, Craig Lesser, who is on the foundation board and the hospital board, and Dr. Mark Brown. We did this so we could have an alignment between the foundation and the hospital. And the realignment actually marks a new era of collaboration, transparency, and shared purpose between Nashville General and the foundation.
Great.
Thank you.
Thank you, Kate. Kathy, do you have anything else you want to share? Does anybody have any question or comment regarding Kathy and Kate's presentation? If not, let me just say a couple of words, and then I'd like to hear from our committee members. When I joined this board about 2.5 years ago, I didn't realize how complicated this place is. It's a hospital, which is a pretty big business by itself. It's in the healthcare regimen, which is maybe the most complex set of issues we're dealing with in the United States today. And third, we operate in a public environment. We get public funding, and we serve a very unique population. When you combine all of those elements, it's something that Dr. Martin has always been familiar with in his healthcare role, but it was very new to me to understand the integration of all of these things and how challenging it is to come in here every day and get the job done. And part of the role I think we have on this committee as an extension of the board is to help with our ideas, our input, our experience, questions, to help the staff understand, or not understand, they're already doing the work, but to support them in their everyday efforts as we try to reach more people, both for public exposure to understand what we do here and to reach more people that need the kind of care we can provide. So there's lots of elements to all of this. There's the foundation and raising money, and how do we go after additional money, the regulations that we have to deal with. All of these things make this place a very complex place. But what I think we as a committee can contribute is our experience in various other initiatives, our knowledge of this community, and combining together, throwing ideas out to see what we can do, working in tandem with Kathy and her folks and Dr. Elders to make sure we're maximizing the good work that goes on here every single day. And that's really the key. How do we maximize that good work and make sure that we're doing the best we can possibly do to support this community and the people who need our services? So with that, I'm going to ask Dr. Martin, you've been here a good bit. You've been participating in this hospital for a number of years. You're a healthcare professional. You're a retired physician. Give us some of your thoughts as you thought about and contemplated being on this committee.
Well, I think it's good that we've organized a group of board members to get close communication with the foundation board. I think this committee could be material in studying the future of the hospital. We have made a lot of progress over the last 8 months in studying and improving the organization of the leadership and getting a better grasp on the finances of the hospital, and the remaining piece for a new era is to figure out what this hospital is going to look like in 5 years. So there are a lot of groups of people who are interested in that, but there's not a group of people that's taking the leadership role in that currently, in my opinion. Perhaps this committee could be a part of taking that on.
Thank you for your comments, Dr. Martin. Mr. Harvey?
Well, it's always good to understand the landscape that you're working in and to know who are the stakeholders and who's who's playing what role. So for me, having this handy dandy piece of paper helps me kind of see who the stakeholders are, and hopefully I think the sources of strength and clarity as we move forward in understanding how things work here and how we can make an impact. Not really big on lip service. I like things to actually get done. So I'm a fan of doers, and I'm excited about finding out about the people here.
Thank you for that, Mr. Harvey. And in terms of doing, I would encourage you to get with Kathy at your convenience and hers as well to learn a little bit more about some of the things that the marketing folks are working on. So that gives you an even broader perspective on the direction that we're currently going in and which audiences we're working with and what those vehicles are as we proceed. So thank you for your comments. Dr. Scott, I would ask you the same question as you contemplated not only being on the board, but this particular committee. Any thoughts that you have as we've heard from Kathy and Kate today?
Well, the truth of the matter is I was told I'm on this committee and not asked.
That's how our chairman works.
Nevertheless, listen, I think Nashville deserves a state-of-the-art safety net hospital where people are receiving good, equitable care. And it is a shame that this hospital does not have some of the same resources that other hospitals in this city has. And with that being said, I think that this committee can help to raise some of the funds that is necessary to make this a state-of-the-art safety net hospital. And our mayor and our city council has a responsibility to make the investment to make this a state-of-the-art safety net hospital.
Thank you, Dr. Scott. In the aftermath, I know early on, Dr. Elders, I asked you to make a comment, but now that you've heard more of this discussion, any thoughts as we proceed as it relates to our perspective in the community?
Can I hear your response?
Well, I've been running my mouth since the very beginning of this meeting. As I said before, I came to this thinking maybe I can add a little bit of my background and experience in marketing, in external affairs, in politics, to help with strategy. I think the board's role, as we've all agreed over time, and is in statute and in our bylaws, we're about policy. We're about policy and strategy. We're not about daily operation. And I want to make sure that that is very clear, that delineation. But I think it's very important, as I have learned over the last 2.5 years, that there's so much more this community, should understand about what happens here at Nashville General. That somehow, with the limited resources that Kathy has had over time, that the hospital has had, in order to expand the reach out. I mean, if we had lots and lots of money for marketing, it'd be a very different situation, but we don't. How do we get out there? How do we make sure that all of our neighbors, who may not need to come to this hospital, but understand the value of this hospital in the Nashville community, and that it does have a meaning for people of all socioeconomic levels, not just the people who are potentially of the lower socioeconomic strata that come here, but for everybody, because a healthier Nashville makes this an economically viable community for everybody, for growing jobs, for growing investment. I'm throwing in my economic development background here. But that's really what this is about. That's why it's important for our politicians to understand that a healthy Nashville General reflects a healthy Nashville. And that's appealing to people who might want to come here. That this community takes care of its people, that this community cares. And I think there's a gap. And hopefully, through the work of this committee, the work of you and your staff here at the hospital, we can do a better job of sharing that notion in this community, getting more support, and helping more people. And if we can do that, maybe we will have accomplished something.
I can speak now, Chairman. And so as I listen to each of you gentlemen talk about the things that you feel like we can accomplish with this committee, I am excited, humbled at the same time, because we have a unique opportunity to bring community awareness. You each bring a different gift and talent to helping us, as this is called the Advancement Committee, in which we have not had in the past. And so we need people to be interested in advancing Nashville General Hospital. It is needed. And as I'll say, things continue to unfold at the federal level, it will be needed even more. And so we need partners to reach out to community supporters and get support for Nashville General, because it will be needed. And we do need a upgrade to where we are. And so our patients deserve it. I say our staff deserves it. They work really hard. And I'm among some of the best and brightest caregivers that I've seen in my career, and I've been in healthcare for 30 years. So you all support is what we need. And so as I listen to all of you, we need your support. So advance us if this is the Advancement Committee.
Thank you, Dr. Elders, for your support for our committee as well, and for your leadership here at the hospital. I might otherwise call this committee the External Affairs Committee, because this committee is really about the people outside of this building and how we approach them, what they think of us, how they can help us. And so it encompasses a lot of different things. And I would ask my fellow committee members to be thinking of that as we begin anticipating our next meeting in January. In the interim, I would encourage you, all of our committee members, to spend as much time with Kate and with Kathy and the staff as possible to learn a lot more about the different programs, the different initiatives that are going on. And there are many. I learn more and more each time I come here, and I try to come here once a week just to spend time and learn. And I'm overwhelmed sometimes at the multiplicity of initiatives going on just in Kathy's group. Nonetheless, all of the other things happening here at the hospital. It's pretty amazing. So with that, unless there are other comments or questions for Kathy and Kate, are there? If not, I will ask for a motion. Kathy, you have something you want to say?
I just want to reiterate something we had spoke about last night at the foundation board meeting, that I think one of the strongest things for this committee will be that as we're looking at things that are on our capital list, things that might not get funded, we'll be pulling together a wish list to bring to the board, which would start at this committee here. And then that way, once it's vetted and approved through this committee, then we'll take it to the foundation so that the foundation can then decide how they can best help us achieve those things. So I want there to be just the understanding that this isn't that there's a lot that goes on, whether what starts within the hospital will come up through this committee and then go to the foundation. And then I'm very excited having Mr. Lesser and Dr. Brown on the foundation board, and just seeing the change in that organization over this last year to really help support the things the hospital needs and that the board will need help with as well. So that's all. Thank you.
Great. Thank you, Kathy. Do I hear a motion to adjourn? Second?
Second.
All those in favor? All those opposed? This meeting is adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.